How to insert boric acid suppositories. Maybe you have a yeast infection that just won't go away, or you suffer from frequent yeast infections. Boric acid suppositories, capsules that you insert into your vagina, can be used to treat stubborn or resistant yeast infections. Whether you make your own capsules or get them from a pharmacy, properly used boric acid suppositories can cure, and possibly help prevent future, vaginal yeast infections. Be sure to speak with your doctor or OB/GYN about this method so you understand proper use. Method 1: Using the suppositories. 1. Talk to your doctor before using any treatment. Before using any over-the-counter medicine to treat a yeast infection, see your doctor or OB/GYN to confirm the diagnosis. They will likely do a physical exam and ask you questions about your health history. They will rule out other causes of vaginal discomfort before diagnosing a yeast infection. They can also advise you on how long to use boric acid and warn you of any health effects. Alternate treatments may be more effective for you based on your personal health history. Your doctor can give you a prescription to take to your pharmacy to have capsules made. When you go to your doctor, be ready to discuss the history of your symptoms and how they have evolved, including how many yeast infections you've had in the past and what is similar and different this time. 2. Get the capsules made at your local pharmacy. If you decide not to make your own boric acid capsules, you should be able to get them from your pharmacy. The pharmacy will have to make them because they're not currently sold pre-made. Call in advance to ask, because some pharmacies will not make them. If necessary, call around to find a pharmacy able and willing to help. It will help to tell them what you intend to use it for, so they don't think you're trying to poison someone. Boric acid is also used to kill rats. 3. Insert the suppository properly. Wash your hands and the outside of your vagina using mild soap and water just before bedtime. Lie down on your back and gently bend your knees with your legs slightly apart. Use your finger or an applicator to insert the boric acid suppository as far up into your vagina as it will comfortably go. Wait several minutes for the suppository to dissolve before sitting or standing up, or just thoroughly wash your hands, then go directly to sleep. If you're using a reusable applicator, clean it as directed by the manufacturer. Otherwise, throw it away. If it's hard for you to insert the suppository while lying down, try standing with one foot propped up on the edge of the bathtub or a chair. It's normal to have some discharge when using suppositories. Wear a panty liner to bed to avoid staining your underwear. 4. Do 14 days of treatment to cure a yeast infection. To get rid of a current yeast infection, insert one suppository before bed for 2 weeks. Do not use more than one per day, or use them for longer than 2 weeks. Depending on the severity of your infection, 1 week of treatment may be sufficient. If your symptoms completely subside in 1 week, you can try stopping treatment. The first time you use this method, it's best to consult with your doctor or OB/GYN. 5. Prevent recurring infections with biweekly use. After you treat the yeast infection you currently have, use boric acid to prevent future infections. Use one suppository 2 nights out of the week, for instance, every Tuesday and every Friday. Do this for 6, 12 months, or as long as your doctor recommends. 6. Take a probiotic during your treatment. Boric acid is good at killing both fungus and bacteria, so consider taking a probiotic daily while you're using boric acid suppositories to help promote healthy bacteria in your vagina. You can get probiotic capsules at the pharmacy, or eat yogurt with live cultures. You can alternate using Lactobacillus acidophilus suppositories during the day and boric acid at night. Method 2: Using boric acid safely. 1. Do not use boric acid if you're pregnant. Boric acid can affect the health of your baby. If you're pregnant and get a yeast infection, talk to your OB/GYN about alternate treatment. Do not use boric acid suppositories. 2. Use alternate treatment if you have open wounds on your vagina. Do not use boric acid if you have any broken skin that the boric acid can possibly contact. This includes open sores, wounds, or cuts in or around your vagina. Also be sure to wear gloves if you make your own capsules and have cuts on your hands. If the powder contacts your skin, other than inside your vagina where it's meant to dissolve, wash the area thoroughly. 3. Never ingest boric acid. Boric acid can be a safe and effective treatment for yeast infections when inserted into your vagina. However, never take a boric acid capsule by mouth. Boric acid is toxic when taken orally. If you accidentally swallow boric acid, seek emergency medical assistance immediately. Ingesting boric acid causes vomiting, diarrhea, and abdominal pain and can be fatal. If someone else accidentally swallows it, be prepared with the following information when you call for emergency services: the person's age, weight, and condition, awake, unconscious, vomiting, etc., how much was swallowed, and what time it was swallowed. In the United States, call 1-800-222-1222 to speak with the Poison Control Center for further tips while waiting for emergency services. Method 3: Creating your own capsules at home. 1. Gather the materials you'll need. To make boric acid suppository capsules at home, you will need the following tools: boric acid powder, not crystals, empty size 0 gelatin capsules, a clean sheet of paper, and a clean kitchen knife. Boric acid powder should be readily available at most convenience stores such as Walmart, CVS, and Rite Aid. If you cannot find it, a pharmacist can probably order it for you. Look for empty gel capsules at local stores and pharmacies like Walmart, a vitamin or health food store, or order them online. You may also want to wear latex or rubber gloves, as boric acid can irritate the skin. 2. Fill your capsules using a sharp knife. Lay a clean sheet of paper on a flat surface to catch any spills. Over the paper, dip the small tip of your clean knife into the powder and use the knife to carefully spoon the powder into an open capsule. Close the capsule tightly. A capsule should contain around 600 mg of boric acid. Fill the capsule with as much powder as it will hold. 3. Fill your capsule using the funnel method. If you'd prefer, use your sheet of paper like a funnel to fill your capsules. First, make a sharp crease down the middle of the paper. Then put a small amount of boric acid on the paper, and tilt the paper so the powder pours neatly into the capsule until the capsule is full. Close the capsule tightly. 4. Store them in a cool, dry place. It's okay to make up many capsules at once. Store them in an old vitamin container or other waterproof, sealed container. If possible, put a small packet of silicone in there with them to help prevent moisture. They should keep well for up to a year. Do not store them in the refrigerator. Tips: Boric acid suppositories may cause some burning and skin discomfort. This is normal. Insert them completely into your vagina to minimize the risk for skin irritation. Treatment with antifungals, medicines ending in azole like miconazole, is more common for single, uncomplicated yeast infections. If this is your first diagnosed yeast infection, first try an over-the-counter medicine like Monistat. Speak to your doctor before using boric acid suppositories. To help prevent future infections, keep your vagina clean and dry. Use unscented soap, take showers instead of baths, wear cotton underwear, avoid tight pants and pantyhose, and always wipe front to back after a bowel movement. Avoid sex during your treatment to help clear up symptoms more quickly. Keep using your suppositories even during your period. Warnings: always consult your doctor before using any at-home remedies. Do not use more boric acid capsules than prescribed, and do not use more than one per day. If your body absorbs too much of it, you can get kidney failure or serious problems with your circulatory system that can be fatal. Never use boric acid on children. Keep capsules away from children to prevent accidental ingestion. Do not use boric acid suppositories if you are pregnant or might be pregnant.